How do you recognize adverse drug reactions in med school? Imagine your patient comes in with a sudden rash, stomach pain, or feels dizzy after starting a new medication. How do you know if it's an adverse drug reaction? That's what we're here to figure out. In medical school, recognizing adverse drug reactions starts with understanding what they are. They are unwanted, harmful responses to medicines that can be mild like a rash or severe like organ failure. These reactions are classified into different types. Type A reactions are predictable and usually dose-related, like feeling hypotension after taking blood pressure pills. Type B reactions are unpredictable, like allergic reactions or hypersensitivity. Type C reactions happen with long-term use, such as osteoporosis from steroids. Type D reactions are delayed, like cancer from certain chemotherapy drugs. Type E reactions happen when stopping a medication suddenly, like withdrawal symptoms. Type F reactions involve therapeutic failure, meaning the drug doesn't work as expected. Next, students learn to take a thorough medication history. This includes all prescribed drugs, over-the-counter medicines, and supplements. Knowing what medications a patient is taking helps connect new symptoms to recent drug use. When a patient develops new symptoms after starting a medication, it's important to keep a high suspicion that it could be an adverse drug reaction. This is part of the differential diagnosis process, where you consider all possible causes for their symptoms. Understanding common signs of adverse drug reactions across different body systems is essential. For example, skin rashes are common with antibiotics or anticonvulsants. Gastrointestinal issues like nausea or diarrhea can be caused by many drugs. Liver enzyme abnormalities might point to drug-induced liver injury, often from acetaminophen or certain antibiotics. Cardiovascular changes, such as irregular heartbeat or blood pressure swings, may also be signs of adverse reactions. Medical students are also trained to use causality assessment tools. These are structured algorithms that help determine if a drug caused the reaction. They look at factors like the timing of symptoms, whether symptoms improve after stopping the drug, and if reintroducing the drug causes symptoms again. These tools help avoid jumping to conclusions and ensure accurate diagnosis. Pharmacology basics teach us why adverse reactions happen. Factors like genetics, age, and immune responses influence how someone reacts to a medication. For example, some people have genetic differences that make them more prone to side effects from certain drugs. Understanding pharmacokinetics and pharmacodynamics helps explain why doses matter and how drugs interact with the body. Monitoring and reporting adverse drug reactions is a key part of pharmacovigilance. Medical students learn to report reactions to health authorities, which helps improve drug safety for everyone. Recognizing ADRs also involves working with other healthcare professionals like pharmacists and nurses, who play vital roles in managing these reactions. In clinical practice, case-based learning is common. You'll analyze scenarios where patients show signs of adverse reactions and decide what steps to take next. This might include stopping the drug, providing supportive care, or switching to a different medication. So, recognizing adverse drug reactions in medical school is about combining solid pharmacology knowledge, careful patient history, clinical observation, and using structured tools. It's all about keeping patients safe and making sure medications do their job without causing harm.